dear students. Today's class is ossification centers of elbow joint, lower end of humerus, upper end of ulna, upper end of radius. Lower end of humerus contains four centers: medial epicondyle, trochlea, capitulum, lateral epicondyle. Capitulum, it is visible here, appeared but not fused. Trochlea, not yet formed. Medial epicondyle, formed. Lateral epicondyle, not formed. Olecranon process, not appeared. It is not seen in this view. Radial head, upper end of the radius, appeared but not fused. Coming to the ages of chronological order. Capitulum appears by 1 year, medial epicondyle by 5 to 6 years, lateral epicondyle 11 years, trochlea or olecranon process appear by 9 years. Upper end of radius 5 to 6 years, upper end of ulna or olecranon process 9 years. Here we can see the joint, elbow joint, medial epicondyle appeared but not fused, trochlea, capitulum, upper end of radius, upper end of ulna, lateral epicondyle, capitulum, trochlea, both three are fused but not fused with the shaft. Medial epicondyle appeared but not fused. Medial epicondyle forms separate epiphysis. It will fuse with the shaft directly by the age of 16 years. Conjoint epiphysis is formed by lateral epicondyle, capitulum, trochlea. These three will fuse by 12 years. These three fuse by 12 years, forming conjoint epiphysis. Conjoint epiphysis unites with the shaft by 14 years, 14 to 16 years. Upper end of the radius appeared but not fused. This will fuse by 16 to 17 years. Olecranon process not much visible here. You can see the lower end of the ulna, lower end of the radius, lower end of the ulna, styloid process, pisiform bone. You can see here, pisiform bone is not seen. So we can say that 12 years, by 12 years, not yet, no pisiform bone not yet appeared, age less than 12 years. In this X-ray, a small tiny dot is lateral epicondyle. This is medial epicondyle, upper end of radius, upper end of ulna, capitulum is formed, trochlea also formed. Lateral epicondyle forms by 11 years. Trochlea appears by 9 years. Medial epicondyle appears by 5 to 6 years. Is about to appear, not completely formed, 11 years. Base of the first metacarpal bone not fused means less than 15 years. We can expect pisiform bone here. This is pisiform bone, lower end of ulna, lower end of radius. Pisiform bone appeared for 12 years. Lateral epicondyle is appeared 11 years. Base of the first metacarpal bone is not fused, 15 years, less than 15 years. Age is 12 to 15. Elbow joint is the best single most ideal joint to determine is a major or minor to determine at the age of 16 or 17. All the centers will unite by 17 years. Lower end of the humerus unites by 16, upper end of the radius or upper end of the ulna unites by 17. Anyhow, all the centers will unite before 18 years. So, elbow is the single most ideal joint for determining the major or minor. Here we can see lateral epicondyle, capitulum, trochlea. These three are united, conjoint epiphysis, whereas medial epicondyle forms separate. Medial epicondyle forms separate epiphysis, unites with the shaft directly by the age of 16 years. Upper end of the radius not yet fused, age below 17, below 14, or sorry, below 16. You can narrow down the age of, you can see first metacarpal bone, base of the first metacarpal bone unites by 15 years. It is not fused. That indicates age less than 15 years. Conjoint epiphysis is formed 14. Base of the first metacarpal bone is not fused, less than 15. So you can say 12 to 15 or even 14 to 15 also correct answer. You can see this is this X-ray is not good. Okay. You can see the lower end of ulna, lower end of radius, pisiform bone you are expecting here. If it is appeared, if it appeared means 12 years. So lower end of the radius ulna is not fused. Age less than 19 years. Yeah, is a good X-ray. Lateral epicondyle, capitulum, trochlea, medial epicondyle. Medial epicondyle not fused. Even conjoint epiphysis not fused with the shaft. 14 years. In this X-ray, you can see the medial epicondyle and lateral epicondyle. Everything is fused. Upper end of radius, upper end of ulna, everything is fused. This age not less than 17 years. You can narrow down the upper limit. This lower end of the radius, lower end of ulna, this ulna radius. These two is about to fuse. Fusion is already started. This part is fused, this part is not fused completely. So less than 19 years, 17 to 19 years. Lower end of the proximal end of the first metacarpal bone is fused and pisiform bone is appeared. Dentition, you can compare in case of in such a case 17 to 19 is a major or minor. It is very difficult to say it is a minor or major previous X-ray. In such case, you can go through the other parameters of secondary sexual characters and eruption of teeth. Age of mixed dentition 6 to 12. Thank you, my dear students.